Let's talk a little about communication, and I will share an example. So, there was a time when my son was under the weather, and we had gone to one of these hospitals in Solere. Now, he was on the mend, and he was to be discharged the next day. And then we ordered the in-clinic meal for him, so he ate. While he was eating, I was having a casual conversation with the matron there, and she was telling me about the fact that you have to be careful when you are giving these children meat. Make sure that you cut it very small. And then she told me about the episode of a child who had taken a huge chunk of meat, could not breathe, and at the end of that child lost his life. That conversation stayed with me for a long time because every time I want to give my child beef,
Dice
I
it.
want to be sure that is.
Well diced.
So she had left me with fear that day. She had left me with double thinking things as simple as this boy is old enough, he should be able to cut this meat himself. And this takes me to the question of how are you as medical professionals expected to communicate to families without putting them in a position where they are constantly afraid, constantly fearful, and yours is a peculiar one because it's also surgery, right? If
Yeah.
a child is done with surgery, how would that child go back to their lives as children, or would it be a case of don't let the child do this, don't let the child do that? So communication, what would be your advice when it comes to how medical practitioners, and I'm not just talking about doctors now, from the nurses, to the matrons, how should they communicate with families, especially when it has to do with their children?
That's a very good question. It brings us back to the central theme of empathy. I think that's the most important ingredient in any conversation with children and their families. That empathy it makes all the difference because that means you're kind of putting yourself in the person's shoes. Okay, if I were in that scenario, how would I be feeling? Okay, and if I were to feel in that way, how would I love to be talked to? Okay, so having that in mind is what will guide your communication with parents and caregivers and the like, and that's the template. Unfortunately, in training, okay, it's not really so formalized like that because we definitely get taught about communication, but in practice, I've realized that I believe that everyone will end up practicing the way he chooses to. Okay, so I personally have made that choice to be a communicator. Okay, and that makes the difference in the quality of care that we deliver. I say that because people just come and some just say, so a lot of people have complained about coming to hospitals and they don't even know what they are being treated for and stuff. And they come, stay all through and go. They don't know what they're being treated for. That's a two-way street, Sha. Okay? Two-way street, okay? Because I'm saying that because sometimes doctors actually tell and talk and talk and talk, and because they are in a heightened state of anxiety, they don't really imbibe what
Has been said.
what has been said. And that's the place where one has to keep sometimes repeating to oneself until the message passes through or gets through. Because when they come in that anxious state, it's sometimes they don't really hear what you're trying to say, except if you make conscious effort to get them to tell you back and give you feedback, which is actually the ideal way anyway. Give you feedback. Can you tell me what I've said? So can you just repeat what I've said in your own words? So that way okay, they heard you.
That almost feels like a contact center.
That's important because especially when you're dealing with procedures, consent for procedures, because that there's a lot of is rising medical legal issues in medical practice, even in Nigeria. So one has to be very sure that the message that was passed was actually passed. So tomorrow you'll not hear stories that touch the heart. Okay. So talk about communication. I believe that it should be open, ended. You should be honest. Honesty is very important. That's because sometimes there are actually scenarios where things are not good. Yes, that's the truth. In medicine, it's not all smiles. Sometimes people die, children die. That can happen. In spite of all your care, some children may die. Sometimes children die because they come late. They present late for care. Okay, so in that kind of scenario, one cannot. It is dishonest. It's not fair to be painting a picture of hope when in reality there is little or none. So being honest is very important, but not just being honest in a brash way. Be honest, but at the same time, you try to understand the person's emotion and communicate that information in a way that meets them where they are. So yes, communication is important, but that has to be honest. That has to be factual. Tell them the truth. This I'm going to do for you. It is not necessarily going to be exactly the way it was when God made it, because you are not God. I'm just talking because I have a surgical background, right? Yeah. So when you're fixing stuff, it might not be 100% the way it was before, but definitely it's going to be back to as near normal as possible. Okay, in some scenarios. So being factual upfront makes the difference. Don't create unwanted unrealistic expectations. Okay, tell them the way it is. Be honest, but be also be empathetic about it. Okay, and tell them all the options that are available to you and what you typically do. Communicate to them your experience too, because that has a way of also calming them down. So that way you can get them to be on the same page. And that's for me personally. That's the way I want to be. Before I take on any patient or take any patient into theater, you must be on the same page with me. There mustn't be any form of coercion. If you get what I'm trying to say, you're not coming to theater because Dr. George says your child needs to be operated. No, come to theater because your child has a condition, and we both agree that surgery is the only way out. So that way, I didn't force you. No. Your child needs it. I'm providing the service. So we are on the same page. Once I detect any iota of doubt or feeling of, okay, I'm not too sure, that surgery is not going to go on, I'll allow the parents, let them seek a second opinion or discuss with their spouse, with their family members. They themselves will come back and say, okay, we are ready. Sometimes the condition, we force them to come back. But at that point, we are now on the same page. Say, doctor, when can we do it? Now you're talking. So it's not that I've made you do it, no. Yeah. So that tomorrow, because if anything goes wrong, you say, doctor, it's doctor that after all, I didn't want to do it. Doctor is the one that made me do it. So no. So that's it. My personal experience finally will be that I kind of deliver a lecture before I engage. You get what I'm trying to say? So I would have told you what the condition is, what it can result in, then for the procedure itself, what to do before the surgery, what's going to happen during the surgery, the possible complications, and what to do after the surgery, down to what they're going to eat, what they're not going to eat, because that's what a lot of people ask. So by the time you have gone through everything, ask any questions, most times they tell you, hey, doctor, you answered most of my questions. I'm more or less giving them everything as much as I can. So that way, I've noticed that strategy works a lot. It makes them calm. They feel safe. They feel comfortable with you. And that's like half the job done.